Bienvenue à tous. Welcome to Reporters See on France 24. I'm Mark Owen. In this edition, fentanyl, the most notorious synthetic opioid, 50 times stronger than heroin. Almost unheard of a decade ago, the drug's now become a national public health emergency in the United States. The seeds of the crisis are sown south of the border. For the drug cartels in Mexico, synthetic opioids are a winning formula. Easy to produce and transport, easy to pass off as authorised medicine. Fentanyl adds up to good business for the drug lords. Laurence Cuvillier and Matthieu Comin investigate the fentanyl trail that starts in Mexico and ends in tragedy for too many stateside. Just one tablet can kill.
In certain streets of downtown San Diego, this is now a normal scene. Hundreds of tents. Homeless people, disoriented. Many of them suffering from the same condition. Addiction to fentanyl.
It's pretty simple, that's all you do.
David is 32. He's been homeless for a year and a half.
Like 3 times a day. Right now, I don't have enough money to smoke as much as I would, really. I would smoke more, but...
Last year, his best friend died from a fentanyl overdose. 3 years ago, his fiancée suffered the same fate.
Well, it's scary. I hate saying that, but it's... You know, somebody laying down, not breathing. I've heard of people overdosing the first time they ever do it.
Fentanyl kills 70,000 people each year in the US. So where does this super powerful drug come from? And how, in just under 10 years, has it become the #1 substance made by drug traffickers? To find answers, the first stop is here, Sinaloa, on Mexico's west coast, the cradle of the country's biggest drug cartels. This is where they made their fortunes, first with marijuana, then opium derivatives, next methamphetamines. That was before fentanyl took over the drug market. These two men lived through that transformational period. 23-year-old Flavio, on the left, manufactured the deadly drug. 36-year-old Orlando transported it to the US border. Today, both are in rehab and, once they're out, hope to rebuild their lives. They guide us along the route of Mexico's fentanyl production.
I was there when fentanyl arrived in 2017. It was like an epidemic. We started seeing dead people everywhere.
Flavio has never taken fentanyl, but even working in contact with it could have killed him.
In the beginning, I was told to put together the packets of tablets to send them to the United States. But I started having problems. It's a substance that's toxic even to the touch. You can actually feel the effects. We're well aware of the dangers, but it didn't worry us. Every morning, I'd be the first person in to make up the packages of tablets because I needed that sensation.
Culiacan, the capital of Sinaloa. Victor and his police investigations colleagues get a call from a courier service saying they've identified some suspicious packages.
It's fentanyl.
Almost 15 kilos of tablets. Enough to kill an entire medium-sized town.
Marcaje positivo. Estos aseguramientos son muy frecuentes.
These seizures happen regularly. We do 2 or 3 checks a week. Most are confirmed as being the drug. They don't even try to hide them. They're sending huge quantities and are counting on most of it getting through.
It's a headache for Victor and his team. Pure fentanyl is not considered as a drug, but as a painkiller, albeit an ultra-powerful one, used with the greatest prudence in clinical settings. It's imported from China, like all the other ingredients that go into the tablets. None of them, on their own, is illegal.
Nosotros tenemos mucha más.
The seizures we do are of finished products, the tablets that come out of the laboratory heading for the customers. Before they hit the lab, the ingredients are circulating in small quantities. They're difficult for us to find and are easily confused with other pharmaceutical ingredients. It's really hard for us to track them down.
1 kilo of pure fentanyl makes up to 1 million tablets, costing just €1 per unit. In major American cities, they sell for €10 each on average. The investigators have no doubt about who's leading this business. It's still the notorious Sinaloa cartel. The all-powerful organization co-founded by Chapo Guzman, currently behind bars in the United States, is today divided into several factions. Between them, an uneasy armed peace reigns.
To start up a laboratory, you need an investment of around 20 million pesos. But after that, you'll get profits of 80 to 90 million every month. Therefore, it's essential to have the support of a powerful cartel to get things started.
In Sinaloa, drugs trafficking is a culture, an economy, almost a way of life. Starting in the 1970s, Mexican soldiers supported by the United States would comb the region, destroying fields of marijuana and poppies. Nowadays, they don't see it as worth the effort. Drugs of natural origin have been wiped off the map by the tidal wave of fentanyl. At the time, Orlando was a drugs trafficker.
I started out selling opium gum in Culiacan. Then I started trafficking it to the border. I earned so much money. I was buying the gum at a very low price, but I got good money for it. Since then, fentanyl has arrived, and it's completely replaced natural opium. Everyone has been asking me for tablets.
Synthetic is now the big watchword. No more need to hire workers for the fields, no more need to wait for harvests. And the drugs traders' incomes have skyrocketed, while those of the rural communities has collapsed. Juan Jose has come to help out in one of the region's last remaining poppy fields.
I
had 4 plots of land, but this is the last one. The price has slumped. Now opium gum is worth 7 pesos per gram, but the fertilizers are so expensive. Before you could get 35, 36 pesos per gram.
It's almost out of nostalgia that he's continuing to work the crop and produce the opium gum that the gangs then turn into heroin.
We
grow it almost out of habit. But now I think we'll stop. In the smallest villages, the entire population lived off this. And now they have no other source of income.
Here in Suratato, there's hope that the impressive mountains, cleared of their poppy fields, could soon attract tourists. In the meantime, Juan Jose is going back to farming traditional produce, like potatoes.
Given their market value, it's now more profitable to grow potatoes than poppies.
In the building where the police stock what they've seized, there are still some methamphetamines, marijuana, all in much smaller quantities than before. Fentanyl, meanwhile, is stocked elsewhere due to its extreme toxicity. From Sinaloa, we head north towards the US border. Tijuana, one of the biggest border crossings in the world. Here, fentanyl is everywhere, waiting to be conveyed into the United States. The streets and the people bear its scars.
Los hechos generaron el reporte y lo reportan inconsciente.
Va a ser una sobredosis. ¿A quién tienes de acá del centro?
Alan works for the Red Cross. Sundays are often his busiest days.
What's your name? Diego? Arturo? How old are you, Arturo? Let's help him up.
It's 4 p.m. and he's just treated his 7th overdose case of the day. The man is stunned. His friend, who had taken the same substance as him, is in observation.
I thought it was cocaine.
But it seems it was something else.
Yes.
Has this happened to you before?
No.
Do you take fentanyl?
No, never. I didn't know. I think they sold us something else.
Luckily, Alan has an antidote with him, which has already saved hundreds of lives.
Here we go. Breathe normally.
It's called naloxone.
1, 2, 3. Breathe in. Okay.
It's an efficient remedy, but still difficult to come by. Alan gives away a few doses to the city paramedics.
This one has lost its lid, but I'll give it to you anyway. Here you go. There's 2. I'll keep 1. Can you send me the address? Hey, you ready? Thanks. See ya. It's another overdose.
There's no let-up, time to run to another emergency. Alan believes this is just the beginning of the ravages of fentanyl in Mexico.
It's a really serious phenomenon. It impacts all social classes, all neighborhoods. We've seen cases of children overdosing.
The question is, why do traffickers trick their customers about which drug they're selling? Flavio fills us in.
You can grind down fentanyl tablets. It makes a powder that looks like cocaine. Some of the consignments of fentanyl sometimes didn't have the right doses, and that made them unsellable. We would pulverize them and sell the drug saying it was cocaine, so that the producer's investment wasn't wasted.
To make the tablets and keep costs low, the gangs cut them with cheaper ingredients. Caustic soda, rat poison, hormone tablets for cattle. There's less than 2 milligrams per unit of pure fentanyl.
Fentanyl has arrived on the market, and it won't go away. They're producing millions of tablets every day. Millions. Nothing will ever stop this.
Flavio says he alone was producing between 200,000 and 300,000 tablets each day.
If the dose is wrong, you can die with just 1 tablet from the very first time you take it.
The risk of overdose with every single pill. Mexico, once purely the manufacturing and transportation hub, is now becoming a major consumer market. Ever more packets seized by the police will be prevented from reaching the US, but instead returning into Mexican regions. The era of this ultra-powerful drug seems to have only just begun.
Almost 130,000 Americans died because of synthetic opioids in the year to 2021. The scale of the problem is clear. The deadly tide of fentanyl, a report by Laurence, Cuvillier and Matthieu. Comin. See it again via our website, france24.com. This is Reporters. Thank you for watching. Stay with us here on France 24.